Hello there. Good morning or good evening, depending on where you are. McKenna here with another lesson on caring for our loved ones when terminally ill towards the end of life. And today I want to talk about um, when somebody is actively dying. When somebody is actively dying. What does that mean? I will talk about more in depth about what actively dying means. Today, I want to talk about, can people hear when they are actively dying? Now, some of the things that happen when somebody is actively dying is that their speech diminishes. Their body is too weak. They most probably are band bound, but that doesn't mean that they can't hear. They can hear. So, um, one time I was caring for a young man that was in his dying process. He had a terminal condition. And so I was his chaplain. And I went to see him in a facility that he was admitted because he became too weak to care for himself. So I would visit him there. He was almost everybody's favorite. He was very funny. He was young. So he was relevant to a lot of the nurses and the team that cared for him. So people liked him. And yeah, he didn't have family, but he ended up having a lot of family in the nurses and the team that cared for him. So I had a great relationship with him and talked about his life, made amends with God. He was a Christian and he wanted to go to heaven. He knew he was dying. We talked about it. So the day came when he became premorbid. In hospice care, there's different terms that are used, like premorbid, actively dying, um, transitional. Transitional. It's just a period where, so when someone has a terminal diagnosis, they are still living their life. They are still living. They are still. A lot of people are still moving. They are working. They are enjoying time with their families, or whatever way that people respond during the terminal diagnosis, people respond very differently. It's all based on people's perception of what is going on with them. So, anyway, this young man was transitioning. That means that he was becoming so weak that we believed he was dying in a few days. So he was transitioning and then he became bedbound and he was actively dying. And I received a phone call. I was told that he was actively dying, to come out and do a bedside service for him and for the facility staff and the hospice team that was caring for him, because people loved him and they cared for him. And so I came and I learned a bedside service with prayers, and people just surrounded his bed. And I led a session in reminiscence where people just talked about their experience of him, how he had impacted their lives, and people just loved on him. And I did prayers, people prayed together, and there was a lot of tears. the nurses, people, we are trained on boundaries and um, don't get too emotionally attached to patients, boundaries, and all that. These are all subjects that I'll be covering and talking about. But we are human. We are humans. So, hospice care team people are human beings. And especially this was a young man, he was in his 30s. It's painful when young people are dying. It's painful when anybody is dying. But a young person's death is very sad and painful and harder to deal with. So people were grieving, people were crying, people were just talking to him and just telling him that they love him, that they'll miss him. And we did this bedside service. And after that, I left. And, I said, of course, one of the things that I would always say to my patients is, I'll be back to see you tomorrow. I plan on it. But in case I don't find you, I know where you'll be. If you decide to go before I come back, go in peace. God is with you. Do not be afraid. And so I'll just say my goodbyes, especially for the Christians. And non Christians, I would still say my goodbyes. They would be different because when somebody tells you, don't talk to me about God, which I have had a few that have told me that I don't want anything to do with God. You can't violate their wishes. And so anyway, I said my goodbyes to him and I left. And as I had promised, I came back the next day. And guess what? I found him sitting at the edge of his bed. And the nurses came and we were just laughing. We were asking what happened. And he just was there. He was in tears. He cried. And he said, I can't believe that you all love me so much. And, I was asking him, wow, why do you say that? And he said, because I heard you. And he went ahead to tell me the things that I said. He said, I heard you saying this, I heard you praying this, I heard people saying this and that. And he was telling us everything that we were saying around his bed, thinking that he couldn't even hear. Or, as it's easy for our mind to think that somebody can't hear because they are not talking. But in hospice care, we are trained that people can hear. So, which is why it's important to be very careful what you say around a dying person. So, he was telling us everything and he was accurate. He told us what people were saying, so and so was saying this, and there was laughter and there was more tears, and we just laughed on him. And whoa, okay, what happened? But when the nurses do the vital signs, they are like, he is actively dying. We don't understand this. He is talking to us, he's laughing with us, he's telling us everything we are saying, but his vital signs, everything says he's actively dying. And that was a bizarre situation. But I've seen others just like it, where we do the prayers and say our goodbyes, and the next day we find somebody in the dining room eating the biggest plate of food. And you are like confused. But when you are a hospice worker, you see this enough to where you go, okay, people die very differently. Very differently. It's different for everybody. Although there's certain patterns that are more common among vast majority of people. There are certain patterns, but still the dying process, the actively dying process is very unique for different people, even with different or similar diagnoses. So anyway, he talked to us and he made our day. And that day we just hang out with him and talked with him and laughed with him. And we prayed again before I left. And I said, "Do you want me to come back tomorrow?" He said, "Well, you can if you want. I love to see you." And I said, "Okay, I'll plan on coming." And, again, I said my goodbyes. I said, "I don't know what to expect, but I plan on coming to see you." Well, lo and behold, I came the next day and he was actively dying, with what signs that we see, and we know somebody is actively dying. He was non responsive, he was not talking, and he died within hours of me being there that day, did my prayers, said my goodbyes again, and left. And he died within few hours. So here was this situation of somebody that, I received a call. He was actively dying, came, did a big bedside service. People said goodbyes. The next day, he was sitting at the edge of his bed telling us what we all were saying to him. And he was in tears. He felt loved. He said, "Thank you." He did not have a family, but he was so grateful. He was saying, "Thank you. I know I have a family. And even though I'm going to die, I'm dying so grateful for the love that I have received and for knowing that I have a family." And then the next day, after this big episode of him telling us that he had everything, he died. So, um, very bizarre situations towards the end of life. So today I just want to tell you that when people are actively dying, they can hear. And we are trained, that the assumption is that somebody can hear. It's the last sense that people lose, is the hearing. When their body is getting weak, their sight, they can't talk, they can't see, they can hear. So it's very important to hold conversations that are edifying to your loved one when they are actively dying. Hold conversations that bless them. Still talk to them. One of the things I've seen is that families will come and they'll say, "Can they hear?" And I'll say, "Yes, they can hear." Talk to them. What should I tell them? Some of the things that you can tell your loved ones is, "I love you. I love you. Thank you." Think about situations that they did things for you. If they are your parents, of course, they did a lot. Think of specific things that you can pull their heart and their emotions to say, "Mom, or, remember when you did this and this. Mom, remember when you said this and this. This is how that blessed me and helped me, and I'm so grateful." So talk to them like you are having a conversation. They are there, they can hear you. And when you are talking to them, you are being a blessing to them. Even though they can't talk back to you, they can't hear, some people might talk even to their very last hours. They might be verbally responsive, it's minimal usually, or they can respond through body language. Sometimes it's moving their eyebrows. So if you ask questions, ask yes and no questions. Can you hear me? Uh, Move your eyebrows if you can hear me. And some people would go like this, they'll move their eyebrows. If you are holding their hand, you can tell them, "Squish my fingers if you can hear me." Are you in pain? Squish my fingers if you are in pain. Are you comfortable? Squish my hand if you are comfortable. So the simple phrases, then they can respond via body language, because even though they are not verbally talking to you, they can hear you. So have respectful conversations. Don't talk like they are not there. Um, One of the things that I have witnessed is where families, and they are not doing this because they are evil and they don't care, Most people don't think about it because they are not trained for this, and this is not their area of expertise. And a lot of times, when people are not talking, we can behave like they are not present. And we talk to each other about the person when the person is right there. Don't do that. That's disrespectful. Include your loved one in your conversations. Talk with them when you are in their presence. Talk with them. Include them in in the conversations. Mom, if you're talking to your siblings or to your other loved ones, I remember when mom did this. Mom, do you remember that? This and this happened. Mom, I love you. I just know that I'll think of you for the rest of my life. I'll remember the things, mom, do you remember when mom did this? Yeah, mom, do you remember? And include your loved one in the conversations. Don't talk about them like they are not there. Include them. Talk to them. Always be aware that they are a person and they are there. If you can put that in your mind, that even though your loved one is not talking to you, they are a person and they are there and they can hear you. So talk to them, say thank you. You can also say sorry. Think of situations where maybe you did something to hurt their feelings. You can say, I'm sorry, ma'am, I was such a naughty child. You might say things like that. Mom, I remember when you spanked me because of MBCD. I know I was a naughty child. I gave you a hand time. I'm sorry, mom. Forgive me. And sometimes that will make your loved ones smile in their spirit because they can hear, they are giggling, they can remember their parenting days, and you are appreciating them and they can hear, I'm sorry. Another thing that you can say is, I forgive you. Sometimes parents feel guilty, they feel like they did not do enough. Or a husband, they might feel like they did not do enough. Or a wife, or a sibling, a sister, a brother. People just sometimes feel like, did I do enough? Did I do my part? So it's time to say, yeah, you did enough. Or I forgive you. Remember when you did this and this to me? That was really hurtful. It's okay to have honest conversations because at the end of the day, even when people avoid honest conversations, it doesn't take away the fact that those things happened. And you are giving your loved one a gift. Some of the hardest things I have had to deal with is a husband being honest and telling the wife they cheated on them. And many times the wife know, but they've never had a conversation about it. So hand conversations and family members, children hearing these conversations and the confusion and the hurt and the pain, but the mending. But also think about what time that you are having what conversations. If you never had some conversations, just leave them out. But you can say things that, I forgive you for everything you wronged me. You don't have to be specific, depending on what stage of the dying process a person is can they process that grief at that time. So be sensitive to your loved one when they are dying. They are very weak and they are very fragile. If they are able to talk and they want to talk about things, absolutely. When they are active, maybe you can just say, I forgive you. Just know if there's anything you did to hurt me, I forgive you. I completely forgive you. I pray that God forgives you. That's a gift that you are giving them, and it can help them feel more peaceful so they can hear. And when people are dying, as much as we don't think about it, sometimes we can be so focused, even hospice caregivers, depending on their profession, which is why hospice care is a team. They have nurses, they have social workers, they have chaplains, they have um, CNA, and each profession is focused on their part in bringing their holistic approach to human care. Nurses can sometimes focus a lot on the medication and making sure that people are physically not in pain. But it's important to remember that spiritual things cannot be medicated. So if somebody is having spiritual distress, again, these are all subjects for other times. It's important to involve a chaplain, a spiritual care provider, to deal with spiritual distress in a person, because trying to medicate spiritual distress is just going to be temporary, and most likely that person will die with unfinished business. You don't want people dying with unfinished business. As much as possible, help people deal with unfinished business so that they can die whole and peaceful and have a good death. As much as we hate death, it's possible to have good deaths. And it's also possible to have very bad deaths. And I've seen both ends of it. I've seen very good deaths, and that just means the person who is dying is very comfortable, is very peaceful, and the family a lot of these times is in a good place. The family is saying their goodbyes. There is just this wholeness around the dying process of their loved one. They are saying their goodbyes. They are releasing them. They are saying their thank yous. They are saying their I love yous. And it can be a very whole dying situation. So the goal is to have those very peaceful end of life situations. So just be aware that because somebody is in the dying process and they are not able to talk doesn't mean they can't hear. Now, this is also similar to your loved ones if they are comatose for whatever situation. Maybe they had an accident and they are not able to communicate, they are not talking, they are not moving. Chances are they are very much hearing everything that is being said around them. So, one of the other things that I want to say is if you want to have conversations um, that are uncomfortable conversations, please move them outside of the room. Move them to the hallway. Go out and talk to each other. If there are things that you want to talk about your loved one when they are actively dying, and you don't think per se they are beneficial to your loved one, move those conversations to a different space. Um, some of the things can be maybe your loved one hurt you, you are mad at them, and I've again dealt with family members that are very angry at their loved one when they are dying. Move those conversations to the hallway, or if it's care and maybe the family is trying to understand how should we care for our loved one, how should we change the depends. Maybe the family is uncomfortable changing depends, people will say diapers. Adults don't wear diapers, babies wear diapers, adults wear depends. When they lose um, control of their bowels and their urine is not in control, it's just coming out. And so they need to be changed, they need to be cleaned. Please don't neglect your loved ones. If they're in a state where they are wearing depends and they need to be cleaned, don't neglect them. But there's many families that don't know what to do. So it's okay to move those conversations in the hallway so that you can be taught, trained, and those conversations might move back after most of their understanding, where a nurse may demonstrate to the family, this is how you change and depend. and the nurse might change and depend in the presence of the family. Those who are caring for their loved ones at home, they might change and depend in front of the family so that the family can learn how to do it. But the explanations of how to clean and what happens, they might be uncomfortable conversations. So for the uncomfortable conversations, move them in a different space. Have those conversations, and then when you are talking about your loved one, include them even in the changing process. How do you change? Talk to your loved one. Let the nurses, the hospice nurses, the facility nurses are trained on these things, and a lot of times they'll be talking to your loved one. Hey, so and so, I'm going to change you and depend. I'm going to turn you to the other side. Now I'm going to turn you to my side. And you'll see nurses talking to them constantly, explaining what they are doing. It's respectful to explain what you are doing when your loved one is not able to communicate, or even when they are able to communicate, maybe when they have dementia, other conditions. Still talk to them. Tell them what you are doing. If you are giving them medication, tell them you are giving medication. Even if it's a repeated conversation every day, just do it. Tell them what you are doing. Answer their question. Explain to them so that they know what you are doing. You experience less resistance if they know exactly what you are doing, and they can cooperate. Sometimes they can help you. They can even move their body for you or make it easier for you to move them. So, again, when your loved one is actively dying and they are not responding, that doesn't mean they can't hear you. They can hear you. Be mindful what you are saying around them. Be kind, be compassionate, be a blessing. Be intentional about being a blessing to your loved one when they are going through the actively dying phase, transitional, premorbid, those stages where they are losing their ability to communicate. They still can hear. So talk to them and be kind to them and compassionate. God bless.